Hello, this is Dr. Ford Brewer with state-of-the-art preventive medicine, heart attack, stroke, cancer prevention for anyone with YouTube access. Today we're going to be talking about high-intensity interval training. And no, this is not just for athletes. This is for us baby boomers that want to prevent heart attack and stroke, especially the majority of us who have insulin resistance or full-blown diabetes. And in fact, the key part of this video is how to do that if you have, if you're not in shape, even if you have certain disabilities. I have patients with knee problems, back problems, other issues. But before we get into all of that, let's talk about comment about the history. When we were young and doing a lot of exercise, most of us were headed towards what we called LSD, and I don't mean the drug, I mean long, slow distance. It was jogging. That was the big thing. And I think the idea then was to increase the basal metabolism. There wasn't a lot, you got significant improvements, but there wasn't a lot of research at that time comparing the different types of exercise. The other types being resistance training and high-intensity interval training with the long, slow distance. As you look at the research over the past 5 years or so, the interval training and resistance training have really won out in terms of insulin resistance, at least. And again, for most of us, that's what we're really focusing on. Why do these work for insulin resistance, and what's going on there? Well, medically, as you know, there are a couple of ways of getting sugar out of our blood. We don't want our blood sugars to routinely be over the 80s. What happens is sugar in our blood actually binds to proteins. And if you look at hemoglobin A1C, another term for that is glycosylated hemoglobin A1C. And glycosylated means there's a sugar molecule that has attached itself to the hemoglobin protein molecule. It's not good to have your proteins glycosylated. Now, so a little bit of science and rationale behind that. What is it? A high-intensity interval. What does it look like? How do we know that we're doing it? There are two basic ways of measuring your intensity level in terms of your metabolism. One is with pulse, and you really can't stop and take your pulse during a high-intensity interval. If you do, you're slowing back down. Many of us have pulse measurement devices. Frankly, those have a lot of problems too. I've tried many of them. Some of them work. I've gone back to the old style, simple breath test. And here's the thing. If you're breathing such that you can't talk, you can't sing, you can't communicate at all, you're going, that is probably getting you to where you need to be. So depending on our age and fitness level, we're wanting to get our pulse clearly over 130, again, unless you're on beta blockers. And we'll talk about that later. Most of us over 140 pulse or 150. And let me tell you, if your pulse is going 140 or 150 and you're a baby boomer, you are not able to communicate with anyone or hum or any of that. Again, for beta blockers, that's another reason to use breathing, because beta blockers are a common medication given post-stent and given for blood pressure. Beta blockers stop your heart's ability to increase. Do these intervals still work if you have beta blockers? There's not a lot of research that indicates one way or another, but I would think that they do. Again, let's talk about what an interval is. Professional cyclists actually use, many of them have for years used this interval, 45 seconds of high intensity with 30 seconds of recovery or low intensity. That's one interval. So we're talking total 1 minute and 15 seconds for an interval. You start with 5, then work up to 10, and then increase the intensity and go back down to 5. So a couple of things about that. We're not talking about 5-minute intervals. The only athletes that I know, or the only people I know that get benefit out of that kind of benefit out of a 5-minute interval are the marathoners. And again, we're not talking about training for a marathon here. We're talking about improving our metabolism for heart attack and stroke prevention. So another thing to think about that is, look, let's say you get up to a full 10 minutes of these intervals. I mean, a full set of 10 of these intervals. They're 1 1/4 minutes, so we're talking less than 15 minutes here. Even add a 5-minute warm-up, 5-minute cool-down, and you're talking about a 20-minute workout. You're not talking about hour after hour on the road or in the gym. These are very, very doable, and they should fit within your schedule. If you can't find 20 minutes, we need to talk about that a little bit later in terms of your priorities. How many times do you do these? If you're getting to the proper level of intensity, you should not be doing these every day. You'll overtrain. 2 to 3 times per week is the correct number. Now, when I start talking to my patients about these, I often see them shut down. And here's why. Most of our patients are baby boomers, 50s, 60s, and 70s. Many of them are post-heart attack and stroke. For about 1/3 to 1/4 of them, their only exercise is walking. And so they assume, I could never do an interval training. That's crazy. He's talking about people that are, young people. No, I'm not. Yes, you can, even as a baby boomer and even with significant disabilities, do interval training. And let me give you a few examples. Almost everybody we talk to in that category admits, yeah, I live near a hill. Well, guess what? Walk up that hill and walk up it as fast as you can. And again, you don't want to walk up a 10-minute hill. You want to walk up about 45 seconds worth and then come back down. And then 45 seconds worth and then come back down. 45 seconds worth, come back down. So again, most of our folks that are walkers have realized, their face lit up and they've realized, I can do that. Well, let's say you don't have hills. Well, maybe you have to bite the bullet and use a Nordic track or an elliptical or a treadmill. Maybe you don't. Maybe you've got a parking lot, a multi-level parking lot near you, and you can use that as a hill. I've got a couple of patients in New York who they live on the 5th floor, and they go up the stairs to the 5th floor. That is a perfect interval. For baby boomers, stair intervals are perfect. They also give us significant resistance training in the muscles that matter, the bigger muscles, the thighs, the hips, the calves, those muscles that are able to pull that glucose out of the bloodstream. Let's say you don't have stairs, you don't have a multi-level parking lot, you don't want to use a machine. You know what? You can even do what's called lunge intervals. You go out, you're walking, and for 45 seconds you do lunges the whole time. And I can tell you that will give you a significant interval workout. And like I said before, it will also give you significant resistance training. You know what? You can even try things like a weight vest. These or these. Put them in your area where you're walking and use them. Incorporating some added weight to either your hands with hand weights or a weight vest makes a huge difference in terms of an interval type of activity. guess what? Even paraplegics and wheelchair-bound disabled individuals can do intervals. Look it up on the internet. They do hand cycling intervals. So let's get back and think about it. Are you really in such a condition that you can't do high-intensity intervals? I doubt it.